Let me take a moment to thank the three speakers for their wonderful presentations. It has been amazing to hear what all of you are doing out there for the better health and well-being of First Nations, Inuit, and Métis peoples throughout this country. We have questions that have come in, so we want to take a few minutes to allow some question and answers to take place. So the first is, if Western universities started teaching courses in Indigenous health practices, would this be considered cultural appropriation? So I'll open that to our three speakers. If one of you wants to take a stab at that.
Perhaps I can comment. My colleagues want to chime in as well. I think it's a very valid question, important question that is on the minds of many. And so in my university right now, we've developed an Indigenous health initiative, which is comprehensive across all programs within health science that everyone has been contributing to, including our community partners. And the notion of curriculum development and increasing the number of faculty is at the fore. And so it was a little bit challenging at first because generally folks want to rush to fill the gap and they feel an urgency. And I've also had a steep learning curve on the complexity of changing curriculum and going through massive approval cycles that are very time constrained. But we've landed in a place actually just recently where I developed a critical pathway that is inclusive of principles in developing curriculum. For example, that we're mindful of our Indigenous community partners who are Haudenosaunee and Anishinaabe, and that our knowledge helpers group, which we established to help guide the work, are included and have a voice in determining what goes into the curriculum. So, and that we maintain the spirit of nothing for us without us, for example. And similarly, on the other side, one of the principles is that we, uphold and adhere to the Health Professional Association standards of care, for example, or cultural competencies. And so it really is kind of tricky to navigate at first, but if you can put down some guidelines and some principles, then once people are agreeable to that level and some core content, then, the programs can adapt it to the specific interprofessional focus.
Kim or Sofia, did you have anything to add to that?
The only thing I would say is that, like in some of the work that Sofia and I do, we teach a course at Simon Fraser University on evaluation. And the one thing that we give huge credit to the university for is centering Indigenous worldviews at the very outset of this course. So in my experience doing my PhD at SFU in psychology, like Bernice was saying, I was very isolated. It was a very isolating experience, and being in such a positive and social science discipline, I was always last. In most of the courses that I hear about in public health and social sciences, at the very end of the chapter or the textbook or at the very end of the course, they'll say, oh yeah, and Indigenous health. So I think, to me, like what we talk about is actually taking the time. If we're not making progress, for people who are in class to actually say, wait a minute, let's unpack the worldview that's underlying the knowledge system that we're hearing about, and actually speak up and kind of disrupt a little bit and think about the positivism that underlies so much of the pedagogy that we're taking part in. I mean, there's so much more to say about this, but I'll leave it at that. Great question.
Thank you. So another question came in is, are you aware of any resources for rehabilitation healthcare workers, so SLPs, OTs, PTs, for working with Indigenous peoples?
This is Bernice. I can refer you to our Indigenous Health Initiative website, which is at McMaster within the Faculty of Health Science. We have a resource section there. I don't know if I have seen actually any specific rehab sciences, but we do have a rehab sciences program. And so I will look into that. And if somebody wants to contact me specifically, I can find out more about that for you. A lot of the focus from an interprofessional perspective at McMaster, we've been emphasizing, starting with cultural safety education to ground all professional groups and programs in cultural safety principles. So that's an excellent place to start. And then now we're starting to see that various organizations specific to, each profession is now, looking into, there's a lot coming out of CAUSN, the Canadian Association of Schools of Nursing. Medicine is now producing material. So we're going to start to see more and more, but if you email me specifically, I'll see if I can find out more about that.
We have no other questions at the moment. However, we have some folks who wanted to specifically say thank you for the work that each of you are doing. In particular, I will read out one that says, to each of the presenters, thank you for sharing your knowledge, understanding, passion, spirit, and for what you do to make a difference. And I have to echo that comment. So I don't see any other questions coming in. However, as Bernice said, if you want to reach out directly to one of the presenters, let us know and we'll do our best to connect you. So on behalf of the National Collaborating Centre for Indigenous Health and all those who are in attendance today, I really want to sincerely thank each of the presenters for your presentations. We can all say that we've gained more knowledge through what you've shared with us today. And finally, I want to thank everyone for participating in the webinar, and I wish you and your families and your communities health in the weeks and months ahead during this difficult time of this COVID-19 pandemic. And just so folks know that the Collaborating Centre will be frequently updating on information sources related to this. So again, thank you for everyone for joining us today. Have a wonderful rest of your day. Thank you.